Mei Wan, commonly translated as new pill, is a classical traditional Chinese medicine formula in the category warm organs and clear heat. Its core action is to warm the organs, clears heat, and stabilizes complex cold-heat intestinal patterns. The pattern framework is due in cold-heat complex, classically with roundworm agitation or chronic diarrhea. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is due in cold-heat complex, classically with roundworm agitation or chronic diarrhea. Typical clues include chronic diarrhea, abdominal pain, thirst, episodic vomiting, cold limbs, wiry pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Wu Mei, Zai Zin, Ganjiang, Huang Lion, Dang Gui, Fu Zai, Chuan Jiao, Gui Shai, Ren Shen, Huang Bai. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses food eye and cardiac medicines. Processed aconite is pharmacologically potent. Aconite alkaloids can cause ventricular arrhythmias, hypotension, neurologic symptoms, and life-threatening toxicity if processing, dose, or identification is wrong. Combining it casually with antiarrhythmics, digoxin, stimulants, or other agents affecting cardiac conduction is unsafe. Professional sourcing, correct processing, and close supervision are essential. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses bleeding and antithrombotic medicines. Several blood-moving or blood-nourishing herbs in this formula may have antiplatelet or anticoagulant activity in experimental or clinical literature. The practical concern is additive bleeding with warfarin, direct oral anticoagulants, aspirin, clopidogrel, or perioperative use. Evidence varies by herb and product, so the safest approach is medication reconciliation, bleeding history review, and coordinated monitoring rather than assuming either safety or danger. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Contains processed aconite in the classical formula. Incorrect species, processing, or dosing can cause dangerous cardiac and neurologic toxicity. Species identity is critical for Zai-Zin or Mutong products. Avoid aristolochic acid containing substitutions or contamination. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Mei Wan is best understood as a pattern-based prescription whose action is to warm the organs, clears heat, and stabilizes complex cold heat intestinal patterns. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen and Chen, and current drug interaction and pharmacology references.